Let me start with a scary fact. Rabies is almost 100% fatal once symptoms appear. Not 90, not 99. Almost 100%. And the craziest part? It usually starts from something as small as a bite you didn't take seriously. Today, let's talk about the world's deadliest virus. But in a way that actually makes sense. Welcome back to Medical Lab Simplified, where we turn complex diseases in the most normal way possible. So here's the wild thing about rabies. It doesn't attack your lungs or your stomach. It heads straight for the brain. That's why it's one of the most fatal virus present on planet Earth. When an infected animal, usually a dog, bites you, the virus enters your nerves and slowly travels upward. At first, you feel nothing special, maybe a fever, maybe a little pain at the bite. But once it reaches your brain, conditions like confusion, fear, hallucinations, difficulty in swallowing, and hydrophobia may appear. And after that, there's almost no coming back. This is why rabies is considered one of the most terrifying viruses in medical history. Now, you might think rabies comes only from dogs. But nope, it can come from dogs, bats, cats, raccoons, and also foxes. Basically, any mammal with teeth can potentially transmit it. And in many countries, stray dogs are the #1 source. If you live in South Asia, Africa, or Latin America, rabies exposure is way more common than people think. Rabies doesn't show up immediately. It can take weeks or even months to appear. And that's the scary part. People ignore the bite, clean it with water, and think it will be fine. But early symptoms are super sneaky. Fever, headache, and tiredness. Nothing that screams danger. Until the virus hits the brain. When an infected animal bites you, the virus doesn't float around in your bloodstream. Instead, it immediately looks for nerve cells near the bite and first travels towards your spinal cord and then to brain. Think of nerves like wires in your body. Rabies attaches itself to these wires and starts traveling. From a medical lab perspective, diagnosing rabies is tricky. We can't easily detect it in the early stage. Most testing is done on brain tissue, which means diagnosis usually happens after death. That's how fast and deadly this virus is. Here's the hopeful part. Rabies is 100% preventable, but only if treated early. If got bitten, here are the measures you should immediately do. Wash the wound with soap for at least 15 minutes. Go to the hospital immediately. Take the post-exposure vaccine series. If the bite is deep, you may need rabies immunoglobulin. Do this fast, and the virus never gets a chance to reach your brain. Rabies is deadly, yes. But it's one of the few deadly diseases we can stop completely, if we take it seriously. So don't ignore animal bites. Don't wait for symptoms. Go get treated. If you want more engaging videos on viruses, lab tests, and medical mysteries, hit like, subscribe, and share this video. Because this information literally saves lives.